My name is Sue Irons, class of '89. I am the Veteran Services Specialist for AOG, and our program is relatively new. We started last year. We launched on Veterans Day last year, and our program is to basically what we're doing is what we're doing tonight. We're educating graduates and their family members about the benefits that they could be entitled to and have earned, and connecting them to resources. So we'll talk a little bit more about that at the end, but tonight we're going to talk about one of my favorite topics, and that is VA healthcare. And we could talk for probably a couple of hours about that, but we're not. So I'm just going to hit the high level details of VA healthcare and how to access that benefit that many people are eligible for. A little bit about myself. Prior to coming to AOG, I was a county veteran service officer, and I did that in South Dakota here, which is where I'm talking to you from. I was employed by my county, and I did that job for 9 years. And prior to that, I had no idea of veterans benefits or anything. I just, when I got out of the Army, I had insurance. I didn't think that the VA was going to be there for me. I didn't understand. I just, my vision of VA is for people that, maybe were seriously wounded in combat, and I wasn't. So I didn't think that I could qualify for anything with the VA. And so it wasn't until I started working in the profession that I understood that these benefits are for all veterans, and there are ways to access them if you just have to go about it the right way. So that is what we're going to learn about tonight. We're going to talk about VA benefits. The ones that are highlighted in yellow are the ones that I get asked the most about, and those are the ones when I was a veteran service officer that I helped veterans access the most. And so tonight we're going to obviously talk about VA healthcare, but we will touch on disability compensation as well, because the two benefits are, they do tie together, and so I think it's important that we address both of those. So the big thing that we have here, all caps in bold, you must have your DD-214 in order to apply for any VA benefits. I just got an email today actually from a grad that doesn't have his, and he was wondering how he can go about finding that. And so if that pertains to you, I can help you with that as well. And there are a few options for that. I like to talk about who can help you access those benefits, because it is, as we start talking here, there's a lot of information, and it can be overwhelming. And so I just want to point out that there are people that are trained to help veterans, navigate the VA and all of the paperwork and everything that's involved with that. So the one thing that I like to really emphasize is if you obviously can file for your own benefits, you can apply for VA healthcare on your own, but it's if you don't feel confident in that, or if you just don't have the time to go through that process, there are people that are trained, like I said. Those individuals are veteran service officers that work either at the local government level, so that would be at your county or state level, or veteran service officers that are at VA facilities. And these individuals are accredited. And why that's important is because they receive continuing education, and they receive they are certified basically by the VA in that they have an understanding of the current forms and the laws, and they are held accountable by their accrediting organization. So those are, I think that's important. There are other organizations out there, other businesses, I should say, and individuals that do help veterans, but they may not be accredited. So as you're looking for someone to assist with your VA benefits, I encourage you to look for somebody that has an accreditation. And that top bullet that is a link to the Office of the Inspector General for the VA. And in that you can do a search for accredited VSO representatives in your area. And you can either type your city and state, or you can type your zip code in, and it will populate those individuals, and then it will let you know where they are located and what their accreditations are. There are other ways to look for that as well, and I have another slide at the end that does give more lists more options for you there. And the reason I like to talk about this is because of this. There's like, how do you apply for all these benefits? Yes, there are forms. Yes, it's the government. And so sometimes that can be overwhelming. And so I want to that's why I wanted to hit that up first. But it's for VA healthcare. It is a simpler process to apply versus for disability compensation. You can, as you see here on the slide, you can go online, you can call, and probably the easiest way would be to actually go to your VA healthcare facility and go to the eligibility department, or a VSO, of course, too. What you are going to need is, I'm going to show you the form here that is what the VA uses to when they have what the information that they're looking for. So I want to just start here, and obviously the information is your basic contact information and your demographics. But what I want to point out here, there are some areas in here that are going to be very important. We're going to touch on the next slide, and that is your military service information. And so you will be able to see here what some of that information is. I'm going to highlight this block though down here, this block E, because this is new, and this is the part of the PACT Act that was passed in August of 2022. Effective in March of this year, veterans that have been exposed to toxins are now eligible for VA healthcare. Previously, you had to have served in certain locations or been in combat, or have a Purple Heart, for example, or there are income restrictions to become eligible for VA healthcare. But the PACT Act opened up VA healthcare for many, many more veterans due to the toxic exposure. So that would be this information here. So I just think that that's important to bring out, and we're going to talk about it a little bit more here next. But the other information that's required is going to be your insurance information. And then if you have dependents, you would fill out that information as well. So we're going to go back to our presentation here. And so back to this. So this is, I just wanted to touch on the form. As you can see, lots of information there. So if you can find somebody to help you with it, that would be really good too. So again, you saw this on the VA form 1010 Easy, and these are the criteria, or what allows you to be eligible for VA healthcare. And there is a hyperlink right here that does explain the PACT Act and those exposures that the VA is looking for. So I like to point out that there are a lot of veterans that didn't deploy to the Middle East or didn't go to Vietnam, but were exposed to toxins, and those toxins can be something just like being exposed to exhaust, being exposed to fuels, solvents, things like that. So if you were in a motor pool, or a battalion maintenance officer and you were in the motor pool a lot, or if you were a company XO and you had your motor pool section and you spent a lot of time there, you would have been exposed to toxins. So this is something that is really important, and that it would allow you to be eligible for VA healthcare now. And it's important when you're filling out that form that you get as detailed as possible on the possible toxins. And if you can provide a date range of when you could have been exposed, that's the other thing that the VA is going to be asking for. I want to talk about, again, like we said, we're tying in disability compensation with our healthcare. Disability compensation is when something in your military service has caused you to have a diagnosable disability today. And there are different ways to become service connected. Come back next week and we can talk more about that. But this is basically This is where the VA does recognize service connection for that disability, and you can receive money or compensation for those disabilities. And then there are other benefits available to you based on the level of your disability. We'll talk about that here in a little bit too. Okay, the biggest thing that I get asked is, why should I use VA healthcare? I have health insurance. I have TRICARE. I'm a military retiree. I have TRICARE, or I have Medicare, and I have supplemental health insurance. Why would I want to use VA? And the biggest thing I like to say is VA knows how to take care of veterans. That's what they're there for. Many people don't realize the additional, yes, it's healthcare, and you can go and get treated for an illness, but there are other things that VA can provide you as an individual that your insurance, TRICARE, or Medicare may not cover. And as you can see in all caps with the exclamation point, I have hearing aids. There are not very many insurance plans that cover that, and VA does provide that to veterans that are enrolled in VA healthcare. Veterans that are enrolled are, and the veteran doesn't even need to have a service-connected disability to get access to the hearing aids. The veteran just needs to be enrolled in VA healthcare. So you can also get eyeglasses from the VA as well. And I think that's something that's important. Home health equipment. One of the things that I really like to point out is that VA wants to keep veterans safe in their homes and in their homes for as long as possible. And so if somebody needs grab bars in, by the shower or going upstairs or whatever, the VA can provide that for you. So you say, well, how does all that happen? So down here where it says, once you're in, your primary care provider is the one that makes that happen. That is it. So what is a primary care provider? That is, once you are enrolled in VA healthcare, what you'll want to do is establish care with a primary care provider or primary care team. And you'll want to, and what that does for you is it keeps you active in the system. But then if you are in need of any of the services that the VA could provide for you, your primary care provider is the person that makes that happen for you, that puts in the order for you, that coordinates that care, with your care team. So on your care team, you have your provider, there's a social worker, and there's a pharmacist, and they are the ones that, coordinate your care for you. But that primary care provider is very important. And then you, as the veteran, it's your responsibility to try to keep active within the VA healthcare system and at least try to see that provider once a year. Many times what I tell people to do is, you keep your current doctor. You don't have to stop going to your current doctor, but if you go every year for an exam, which you should, maybe time your exams 6 months apart. So if you see your current civilian doctor, in January, then maybe schedule your VA exams for July. And then that way you're getting checked out twice. One thing I will tell you is your VA exam is very comprehensive. Every time you go, they're going to do lab work for you, and you'll meet with your provider, and your provider is going to ask you what can he or she do for you. And it's a very comprehensive exam. And I've heard people even say that their VA provider, gets into their healthcare needs more so than their civilian provider. Of course, that would depend on the provider, but I like to state that that's something to consider. The other thing, if you are a toxin exposed veteran, then the VA is going to be tracking that for you and looking for conditions that could arise from those toxic exposures. Your current provider may not know to do that because they aren't aware of what you were exposed to when you were in the military. And so that's another reason to use VA healthcare. I have the VA dental insurance program listed there. And what that is it's not dental care covered by the VA, but it's access to dental insurance at a reduced rate. So that's, I just want to point that out. Other wonderful things that the VA offers are, preventative care services. I touched on that a little bit with the periodic health exam. What a lot of people will do once they are enrolled in VA healthcare, they will switch their prescriptions over to the VA and have the VA provide those prescriptions. And they have a program called Meds by Mail, and that is something that the VA would, once you are your prescriptions have been transferred over, your VA provider then would provide that medication, and the medications would then be mailed to you. So that's a really nice benefit that a lot of people really like to take advantage of. These are some other things that are, I think, pretty nice that VA offers. I'm looking at the emergency care. My husband actually 2 months ago broke his foot and was not wanting to go and get it checked out right away. So we waited a night, and then, he made the decision he should go get checked out. And he was going to go to our local doctor, and I said, no, go to the VA. And it's, in a town about, 20 miles from us. And so he thought, well, okay, I'll go I'll go there and get it checked out. And he cannot say enough wonderful things about the care he received there. He went to the emergency room, was seen right away with an x-ray, and then they provided him with all of the home health equipment that he could have needed, crutches, a knee scooter, a bath chair. And if he would have wanted anything else, I think that they would have been able to offer that to him as well. But it was really he was very impressed with that. And I told him, I said, I told you so. And so anyway, the other thing I really think that is important too is mental health care at the VA. And again, going back to VA takes care of veterans. They understand the needs of veterans and what types of situations they may have been involved in, whether that's combat, severe accidents, military sexual trauma. There are many things that affect veterans differently than the rest of our population. And so VA does a very good job with understanding that as well. And one thing that even before COVID, what the VA was doing was providing telehealth, counseling for veterans. And I think that is why I like that is if going to a place to get treatment keeps you from going to do that, but if you could, log onto your computer or your phone and then get access to that treatment, then that's better than not going at all. And that's something that, again, the VA does very well. So these are just another, the inpatient treatment, outpatient treatment, all very good. I want to just talk quickly about women's healthcare. The women veterans are the fastest growing population of veterans in VA healthcare, and the VA is doing a good job to meet their needs. I want to point out that the VA does not deliver babies at a VA facility. So what they will do, and this will apply to non-women veterans too, but they have care in the community. And what care in the community is if the VA can't provide a level of care, whether that's a certain type of specialty provider, or which in this case would be, for women having a baby, or if you need, let's just say you needed to see a certain type of orthopedic surgeon, or if you needed to see a neurologist, or if the VA, those appointments were further out, 30 to 45 days out, and you couldn't be seen, what the VA will do is there is a program called Care in the Community. And what that is your primary care provider would identify that you need this additional care. And if they say that the VA can't provide that in a timely manner, Care in the Community then will go out and with providers that have a contract with the VA, and they will schedule you to go and get that care. So where I live, this is all of the healthcare systems have contracts with the VA, and so they can go many times. What has happened is many times veterans are already seeing that provider out in the community, and then the VA will just send them there, and then they'll pay for that care. And so that's something I think that is very important. And what that has done, and this is a change, in the last 10 years, what this has done is it has improved healthcare for veterans and and getting that access to care and the quality of care. So I think that that's very important. I want to touch on what care in the community, I said what it is, but how to access it. You can't just go you can't say, well, I want to go see my current doctor, so I'm just going to go, but I'm enrolled in VA healthcare, so I think VA should pay for that. It doesn't work like that. You do need that referral from your primary care provider. That's very, very important to understand. And many times, if you ask and you need that care and the VA recognizes that, you will get that referral, but don't go. And this is not the time to ask for forgiveness. You need to get permission first. So I just want to point that out. That's very important. This is one, I think, that, if you are younger and you don't want to think about, well, when I have to go to a nursing home or when when I can't take care of myself, you don't want to think about that yet. But I want to point that out because this is something that we hope to, maybe someday have this as, have a concern. We hope to live this long and hope that that we are able to stay in our home, or that there will be care that helps us stay in our home longer. And this is something, like I said earlier, the VA wants to keep veterans in their homes as long as possible. And so that's why they provide that home health equipment. They also provide home health care, help with bathing, help with setting up medications and coming and doing evaluations. A nurse can come to the veteran's home, every week or every 2 weeks to check and do assessments. And so this is something that is, I think, is a great benefit as well. And so here's a list of those long-term care benefits that are listed here. Okay, let's see. Here we go. Yes. Okay. So coming back to disability compensation, you have a disability that has been determined by the VA to be service connected. The VA then has had you evaluated by a C&P exam. That information goes back to the VA. The VA says, this is what your rating is. And you may have heard, veterans like to ask, hey, do you have a VA rating? And sometimes people will say yes or no. And sometimes they'll ask what it is. The percentage of your rating is basically, what that means is how severe your disability is, or how much your disability impacts your quality of life or your ability to work. And even if you're retired and are no longer working, the VA doesn't, look at that. They look at how does this affect you? So, and that's where disability and healthcare come into play. Will be on our next slide here. So the higher your rating, the more benefits you can receive through with your VA healthcare. Additionally, the higher your rating, the more compensation that you can receive from the VA as well. At the bottom, I have a link to the 2024 information about what the rates are for veterans, and that corresponds with their ratings. So you can look at that. But the VA, when they pay you money, it's tax-free, and so you don't have to claim that on your income tax, and that's a nice benefit. But what I think is probably the best benefit is what that does for you with healthcare. So you can see I've listed the various percentages there. The VA has priority groups when they bring veterans in for healthcare and looking at their eligibility. And the priority group 1 is at 50%. So that veteran that has that rating of 50% or higher will not have to pay any premiums or any co-pays, or they don't have to pay for anything for any health care. So it's not just for service-connected conditions. This would be for anything. So again, the example of my husband with his broken foot, he was able to go to the VA. Obviously, he did not break his foot in the Army. He has been out of the Army for a very long time, but he broke his foot. He went to the VA, went to the emergency room, and he does not have any co-pays. He did not have to pay for any of the medical equipment that he needed to help him recover from the broken foot. So that is an example of how the higher your rating is, the more benefits it opens up to you. 70% is another very important rating. A lot of people don't realize that if a veteran has a rating of 70% or more, they are now eligible for long-term care coverage at a VA contracted nursing home facility. Or they could have a family member care for them at home, and then that family member could be compensated to care for them. So that's something that is a very nice benefit, and again, why that 70% rating is important. And then, of course, 100%. And the big thing, of course, is increased compensation, but also there are education benefits that are available for dependents. And then the veteran then does have dental coverage for through the VA if the veteran is 100%. So that is, those are the levels. And again, we're talking really, really quickly here about a lot of things. So, okay, I am doing okay on time, I guess. Okay, so I talked about, how to find a veteran service officer or how to find an accredited representative, going to the IG website on the VA. What I recommend people do is to go to your state veterans, either the website or contact your state Veterans Administration and ask for assistance to find a VSO locally that way as well. All of our states do a great job of educating their veterans and taking care of their veterans through their veteran service officers that are accredited through the state. So that's a very nice benefit and resource for you. The other thing that I also want to talk about is making sure that when you do talk with your state, there are separate state veterans benefits as well. What we've talked about today is federal, but states have separate veteran benefits as well. And so it's important to get an understanding of what those are. And again, that would be a reason to use a veteran service officer that's local to you, because they would certainly know what those are. And finally, our veteran services program at AOG. We talked about the educating and connecting to resources, but I want to talk about empowering. So, grads are smart people, and once you have that information, you know what to do, and you're empowered now. So what you can do once you know is you can talk to your classmates, you can talk to your society members. But what I really want to think that is important, and probably something that we learned very early on when we were cadets, was we want to take care of our soldiers. So what about the people you've served with? There are people that you may have served with that don't know about their benefits. And so this would be a way to continue to help and to serve, those that you've served with, and to take care of them. So that's the empowering part of that. And I guess that's something I feel is important. And, this is, we continue to serve, the military academy, instills in us a lifetime of service. And so this is something that I feel is important. You have me as your veteran services specialist. I'm a resource to graduates and their families, and I'm happy to talk with anybody about those benefits and how to access them. And the other thing that I have been doing lately is talking to classes individually and tailoring a presentation to the class, specifically to them, or to societies as well. So that is something else that I enjoy doing. And then we have our monthly webinars that you are. Thank you so much for being here today. And I will look forward to hopefully some questions or just some feedback. I would appreciate that. So thank you very much.